Because the bone doesn't get higher here. It twists this way.
Yeah.
But because of the way it's shaped, it feels like it's coming higher.
Did you get the guide thing I printed off?
Okay.
Oh, you got any guides for this?
Yeah.
Oh, you did?
Yeah.
Oh,
Check this one. It should be like right after the cranial stuff.
Oh, cool.
I am naming this as if a patient is laying in front of you guys and how you'll see it.
Oh, that's perfect.
Okay,
Oh, no.
yeah, it's smooth. It's getting more and more fun. All right.
Some my answers should be in quality.
Vertical
It
strain.
should be on there too.
Did you send it in email?
There's two kinds of vertical strains, right?
Yeah.
What kind are they? What are the
Did you send it
names?
in email?
Yeah, that's enough.
Superior vertical strain and inferior vertical strain. What do your fingers do on phantom head for a superior vertical strain? They point downward towards the table. Okay, so why is that called a superior vertical strain? Base of the sphenoid moves up. So here's your sphenoid, and so now we're moving across which axes? Transverse axes, two transverse axes, and you know, if it's easier, we do have those mod those. Two transverse axes that are parallel through the body of the bones, right? And the bones are moving in the same direction or the opposite direction? Same direction. So what happens if you imagine somebody put their hands out and you're doing superior vertical strain, so your fingers are pointing downward, what's happening with these two bones, I'll show you from the side, is you're doing this. And I'm going to exaggerate it to make sure you see it. Okay? So the base of the sphenoid, this bone, is doing what? Comparative speaking for the anatomy, if you stand them up in an anatomical position. It's moving superior. So your fingers feel like they're moving downward because as this sphenoid rotates, as my fingers are here and as this rotates down, see how it drags my fingers down with it? Alright? So that's why it feels like you point downward, but it's because these are both moving along a vertical or along a transverse axis in the same direction. Cool?
So the bottom one wouldn't come down like this, but they both kind of come up?
They both move in the same direction. So see how they're both rotating this way?
Yeah.
Okay, I'll make it really, really exaggerated. Okay, so they're both moving in the same direction. So, or you could say this one's going into flexion and this one's coming into extension, but it's going to be a little confusing. Okay, did everybody see that? I can't tell if I showed you all well enough. Okay, so now, of course, this is superior then. The sphenoid base is superior. So the same deal if you have an inferior vertical strain, which way are your fingers pointing? Upward. And that's because as you do an inferior vertical strain, they move this way. And so the base ends up moving lower than the base of the occiput. So even though our patient is laying in front of us, we're always talking about them in an anatomical position. Which is where you get, Dr. Hammer likes to say a vertical strain is like this, but when the patient is laying in front of her, it's really like this. But when you're talking about anatomically, the bones move forward on one side, move forward on the other side, because in that lateral strain, the bones are moving along which axis?
Vertical.
Transverse.
Transverse.
Are we getting confused now?
All of the above.
I like that. Wasn't right. Okay. They're moving along a vertical axis. Is that what we already said? Okay. Like, whoa,
Transverse axis?
Vertical axes.
Oh, this one.
And they're moving in the same direction. So when this patient's laying down, it looks like this.
So this was a lateral.
That's a lateral strain.
What would you say this was?
That's how Dr. Hammer likes to describe it, but when she's doing that, it's not that you're going towards their feet. She's talking talking about in terms of the anatomical position. So the problem with that is people in her group have this, and in reality, when the patient's laying in front of you and you're doing phantom hands, it's this.
Okay, so when Dr. Hoover did this, for us,
If we have her
Yeah,
correct
it's
this,
like
and if we have
that makes way more sense.
So you guys get that now? Does that make more sense?
I was just making sure you're doing it.
Yeah.
That's why I meant
Cause she had him
Which
as
I found out
standing
yesterday.
up,
I
but
apologize.
Phantom had us laying down.
Oh, okay.
So the axle, everything's tilted backwards.
Don't even think about that. She screwed us off.
She goes, well, in the anatomical position, it's like that. I said, but that's not how we're looking at them. Okay? Which is why I suggest you hold the bones in your hand, how the patient's laying, but to describe the axes, you got to flip them to anatomical position. That's where a lot of the confusion comes from. Okay? And then it's a matter of which axes are involved and do they rotate the same way or opposite ways. Okay? Alright, so flexion and extension. So, which axes? Transverse axes. Yay! That one's the easy one. And do they move the same direction or opposite directions? Opposite. So, in flexion, you get the sphenoid moves away from you, or the wing of the sphenoid moves away from you. The other way to say that is the sphenoid moves superior, just as the occiput moves superior. And these two things together are called the sphenobasilar symphysis, or SBS. It's all the same thing. So they move superior, meaning when we put them in the anatomical position, it comes up higher in the center there. So what you'll feel is your index fingers will move away from you, your pinkies will move away from you, and they'll get kind of wider. In extension, you'll feel the opposite. So the SBS moves how? Superior, inferior in extension? Inferior. Nice. Okay? So two transverse axes through these bones. You guys all know what I mean by transverse axes still? And they're rotating opposite directions. That's going to be probably the easiest one, right? Okay.
I have a question.
Transverse.
Yeah.
For flexion and extension, would that become along the same lines as the strains where we could show you how it works, or do we have to actually sit with our partner and like find it and follow it and have it be verified?
Flexion, all these, everything we've talked about, you're doing it on
Same with
bones
strains? Okay.
in front of your patient.
Okay.
Okay. Yeah.
When you said for extension that the base of the sphenoid goes inferior, does that mean since they go in opposite directions that the greater wing of the sphenoid will go superior?
Say that last part.
For extension, does the greater wing of the sphenoid go superior then?
Correct.
Okay.
Which is why you always name it for the base of the sphenoid.
Okay. So we were asking about the base.
This is where they don't move in the same direction.
Okay, so the base.
Okay. Any question coming about this is really, well, they could talk about the greater wing, but it usually talks about the SBS. Sphenobasilar symphysis. Okay. And the most exciting one. Okay. So again, I'm sorry, if the bones were, if the patient was in front of you for the, we're back to flexion extension, it would look like this for flexion and this for extension. I did it from the side, so I want to make sure that you got your image correctly. Okay?
What was the? You would feel the pens kind of like was that this thing?
What do you feel?
Yeah.
When the patient in phantom head, when the patient goes into flexion, you get fullness.
Okay.
Your fingers move apart from each other. Your hands move apart from each other, and your fingers widen out. And when in extension, your hands move towards you, your fingers come together, and your hands come closer together. So flexion, extension.
So was it the flexion was the Bart head and the other one was the Ernie head? No, Ernie head was this and Bart was this one.
Ernie is the big fat round head, that's the flexion head. And Bert is the tall skinny head, that's
The
extension
yellow
head.
girl.
Or you could say, you know, that what's her face with her big old hair.
March.
Marge.
Oh.
Her head's not that way though, so. So you can find a flexion extension strain. What you'll find, and some of you actually found this when we were looking at just cranial rhythm, you found that I feel it going to flexion a lot easier than extension. Now it's different than I can't feel it go into extension. You just weren't on the rhythm then, but some people